just give us 2-3 minutes so that they can also join. Yeah.
Okay. Okay. No problem. I hope the slides are visible to all of you.
Yes, yes, Dr. Karminder, it's visible. There's no problem.
Okay. So,
how many participants have joined? 50 participants are there. Some more are joining. So, I think let's start with the talk.
okay.
So, all the participants, I requested you to please raise your hand if you can see the screen and you can voice is clear to you all. Yes. So screen is quite visible and voice is also very clear. So first of all, let me take this opportunity to introduce Dr. Karminder with you all.
Yeah.
Dr. Karminder is a very good. We have been after that. Dr. Karminder joined PDS course in Army College of Dental Sciences, Secunderabad. After getting admission in BDS, he completed his bachelor's degree in dental science, and after that enrolled for the MDS program, master's program in the dental sciences in the same institution, and he completed his master's in endodontics. That is the kind of specialization in this dental surgery, dental sciences. After completing his master's in endodontics, he served as consultant dentist in various embassies of the Gulf countries in New Delhi. And after that, he joined as a resident dentist under government of Haryana and served in various general hospitals, commonly called as civil hospitals. And finally, he quit that job and then he joined as a registrar endodontics in Ministry of Health in Kuwait. So presently, Dr. Karminder, who is our today's expert of this talk, is presently working in Ministry of Health, Kuwait, as a registrar endodontics. And today, he will be delivering his talk on the oral hygiene. I think this is a very nice topic, and Dr. Karminder has a very good specialization in this particular field. So please listen this expert talk very carefully, and whatever you have questions regarding oral hygiene, what are the myths and what are the facts, what are the realities behind this oral hygiene, you can raise your question, you can ask your question with our today's expert. So now actually I know the schedule of Dr. Karminder is very hectic. And I think yesterday night we were discussing that how we can share the screen. So uh, Dr. Karminder has a quite hectic schedule, and he spared uh, this much time from his schedule. So I'm really thankful to Dr. Karminder. So will not waste much of your time. Dr. Karminder, please start your talk. Dr. Karminder,
Yeah.
over to Dr.
Okay. Thank you, Yaspal, for such a wonderful introduction. Good morning, everyone. I am Dr. Karminder, and today I will discuss about oral hygiene or the oral health and its what are the various myths and the facts that are associated with oral hygiene. Okay, so what I will do first, I will discuss a little about oral hygiene, a little introduction, and then I will discuss what are the common dental problems or what are the common oral issues and how to take care of them. And after each of uh, that discussion, I will discuss what are the various myths and what actually are the facts about that common dental problem. Okay, so let's start now. So why oral health is so important? See, the oral cavity is an important part of our body, and it plays a lot of important functions for us, like uh, we all see, we speak, we socialize, and we eat. Okay, so all of these functions are we perform with our oral cavity. Okay, so it is very important to have a good oral health. If you want to impress someone with your smile, if you want to eat healthy, if you don't have any teeth, how you will eat? Okay, and if you socialize with people, oral cavity plays a very important role. Now, before going deep into the topic, I will discuss briefly about oral health, how it affects our general health. So most of the people, they think that oral health, our oral cavity is just it's kind of a separate part of our body, and it doesn't play any important role to our body in general. Okay, but it is uh, not the fact. The fact is that there are a lot of general health issues which are associated with dental problems. Okay, the first is the heart disease. Now, there have been various studies and various researches that shows that there is a direct link between a bad health condition and the bad oral hygiene. Okay, so if you have a good oral hygiene, you have a good oral health, you're gonna have to have a good heart. Okay, you won't be facing any heart condition. The second part is, it is showing in the picture, is the psychological condition. Okay, so it is as we all know that if we have a lot of dental problems, or our teeth, it's not good or not looking good, so most of the people, they don't want to socialize, they don't want to interact in the friend circle. It's all because they feel depressed. Okay, so this is also one of the aspect that you should have a good oral health, you should have a good smile, good teeth of set. Okay, now third is the pregnancy. See, it is the most important factor, and most of the myths in our culture in Haryana especially are associated with pregnancy and oral health. Okay, so I will discuss it later. First, I will tell the in pregnancy, there the women, they face a lot of dental and oral issues. Okay, and the next is the lungs. As you can see in the picture, smoking, any kind of smoking like tobacco chewing or pipe smoking, hookah smoking, BD cigarette, is directly associated with lung cancer and also to the oral cancer. And the final is the diabetes. Diabetic people are more prone to oral and dental infections. Okay, so now I will discuss what all are the common oral problems, and the most common is the dental caries or the tooth decay, or we call at rotten tooth, or so many names. Okay, and the second most common is the periodontal disease, or what we say, the gum problems. Now, before talking about the dental caries, let's first have a look at what are the part of the tooth. Everybody should know about it. Okay, the first layer is, if that you can see, is the enamel. Okay, and the next is the dentine. The enamel is the hardest part in our body. Okay, so this must be a new thing for you people, but the hardest part in our body are not the bones or anything, it is the enamel of the tooth. Okay, the second
Dr.
part is the
Dr.
dentine.
Karminder, sorry
Yeah.
to interrupt you. Can you enlarge the screen? I think actually
Screen.
the side panel is visible.
Okay.
Yes.
So,
Now it's good. Please
okay.
continue.
Okay. So the dentin is the softer part, okay, and then you can see the inside the two canals. This is the pulp, and it contains the connective tissue, and the connective tissue means it contains the nerves and the blood vessels. Okay, so the tooth gets its blood supply through the nerves and the blood vessels, and then there is a dentin, and the top part is the enamel. Okay, so this is just a simple morphology of the tooth that you have to understand. Okay, so next, how dental caries progress. Okay, so you can see the white part. Okay, this is the enamel. So first the dental caries start in the enamel, then it goes, if you don't get the filling or don't get the dental treatment, then it goes to the dentine. Okay, so dentine is a much softer part. So to start caries in enamel is as a protective measure, it is the hardest thing. Okay, then when the caries goes into the dentine, uh, it can easily be penetrated by the caries, and when it reaches the pulp, that is the nerves and the vessels, then you start feeling pain. Okay, so this is the thing that we always wait until we feel pain. Okay, so it is better to have the treatment at the initial stage of the dental caries, that is when it is in the enamel. We can remove the caries, okay, and we can fill it so that it doesn't progress up to the nerves and the vessels. Okay, so next, now we'll discuss what are the cause of the dental caries, means why caries happen in our mouth. Okay, so the first, as for most of the dental disease, is the poor oral hygiene. Okay, so if we don't brush properly, or we don't do mouthwash, or we don't floss, then it leads to poor oral hygiene and ultimately the dental caries. Okay, the next most common factor is the sweet and sticky food and drinks. The sweet and sticky food is most common is that not all form of sugar cause dental caries. Okay, so the form of the sugar, as it is written, it's sticky, means the part of the sugar that is attached to the tooth after you eat sugary stuff. Okay, and part of the sugar is left on the tooth, that cause the caries, not all sugar. Okay, so if you are taking any liquid form of sugar, that doesn't cause caries. Now third is the bad or the worn out fillings. Okay, so okay, you have caries, you went to a dentist and you got the fillings, but the fillings are not proper or the broken, then it can initiate the caries. Okay, so that is known as the residual caries. Okay, so what is whatever the caries is left after the dental treatment. The next condition is the dry mouth. Okay, so dry mouth, maybe this is a new thing for you, but most of the people with diabetes, the sugar patients, they have dry mouth. Okay, that's also known as xerostomia, and there are other conditions also, the abnormalities of the salivary glands or various diseases of the salivary glands that lead to dry mouth. So what happens in dry mouth? The main important part of our saliva is to clean our mouth. Okay, so it acts as we are cleaning everything with water. Okay, so it cleans our mouth from all the parts. Okay, so what happens when you have xerostomia or you have less saliva in your mouth? The cleaning part of the oral cavity is not done by the saliva, and then you have bad oral hygiene and the dental caries start. The fifth part is the crowding of the teeth. Okay, so when your teeth are not properly aligned, or there is crowding of the teeth, or the teeth are rotated or something like that, then you cannot clean your teeth. Okay, so in those part of the teeth where you cannot clean, the food will stuck and it will lead to the dental caries. So what are the form of caries? As you can see, the picture on the right hand side is the tooth is the pit and fissure caries. Okay, our tooth surface is never a smooth surface. Okay, it has pits and the fissures. Okay, so what happens? The food stuck in the pit and fissures, and it initiates the caries. And that is the most pit and fissure caries are the most common form of caries. And next is the smooth surface caries. As you can see, the front part of the front part of the tooth is infected with caries, and this happens when you badly neglect your oral hygiene. Okay, normally this part of the tooth never get caries. It's only because after bad negligence. Okay, so these are the most common of caries. And next, you must be wondering why caries happen in our tooth. Okay, even if we don't maintain our oral hygiene, but why it happens? So there are three factors in dental caries initiation and progression. First is the tooth, and then there is a bacteria and the carbohydrate. What happens? The carbohydrate, that is the sugar that we take, if it's stuck on the tooth, the bacteria this take up this sugar and they convert it into the acid. Okay, that is known as the lactic acid, and the most common bacteria is streptococcus mutans, that is S mutans. Okay, so what happens? The sugar stuck on the tooth, the bacteria takes the sugar, convert into acid, and that acid actually is the acid which dissolve our tooth, which dissolve our enamel dentine. So this is how the caries progress. Now the next thing, how do you get to know about tooth decay? How you know that I have tooth decay? Okay, so there are some features. There are some you can see in your mouth. Some of these you can observe some of these conditions that you are getting a tooth decay. The first is the food getting stuck in between teeth. Okay, so if regularly if you feel that when you are eating the food is left in the teeth, somewhere it is stuck, it means that can be a carious tooth. The second is the bad breath. This is the most common. Most of the people, they complain about the bad breath, and sometimes when you socialize your friends or your relatives, they tell you that you have bad breath. It means you might have caries in your mouth, so you should visit a dentist. And the next is the toothache. As I told before, when you neglect your oral hygiene, then the caries progress to the connective tissue, to the nerves, and then you start feeling pain. Okay, the next is the tooth sensitivity. When the caries are up to only to the dentine is also innervated by the nerves. Okay, not so much as the pulp, the inside tooth. So when you have the caries are up to the dentine, then if you take anything hot or cold, you feel too much sensitivity. Okay, so these are the features. These are the small observation that you can feel, and you should visit your dentist if you have any of these conditions. Now, how we will prevent the tooth decay or the dental caries? Okay, so the first and the foremost is to make a good oral hygiene habits, develop good oral hygiene habits. Okay, brush properly, floss. Okay, do mouth washes. The next is the fluoride application. This can be done in two forms. The one is the home care. Okay, so in home care, what happens? We most of the toothpaste and dentifrices that are available in the market, they have fluoride in it. Okay, that is sodium fluoride, sodium monofluorophosphate. Okay, so whenever you buy any toothpaste, just see the content of the toothpaste and see if there is fluoride or not. But most of the toothpaste now, they contain fluorides. The next is the professional application. Okay, so if you cannot maintain your hygiene, then you have to go to the dentist, and the dentist will apply fluoride to your teeth. There are a lot of fluoride applications in form of gels and varnishes. Okay, what happens? We load the fluoride in the tray. Okay, we place in your mouth for 4 minutes, and then we take it out. Then you don't have to rinse for 30 minutes. And what happens? The enamel, it absorbs the fluoride, and fluoride actually what it does, it mineralizes the enamel. Okay, what happens when dental caries happen? There is demineralization of the enamel. Okay, the calcium of the enamel is lost, and with the fluoride, there is a remineralization of the enamel, and it becomes stronger and healthier. The third is the scaling. The scaling is the part where we clean clean the tartar and the calculus from your mouth. Okay, so this is also it is mostly important for your gum health. The fourth is the pit and fissure sealants. As I told you before, most of the caries happen in the pits. Pits are the small depressions on your mouth, on your tooth, and the fissure are the deep lines that are running on your tooth. Okay, so pit and fissure caries are the most common caries. So what happens? What we do, we take a resin kind of sealant and we place in the pits and fissures. So what happens? The pit and fissures now are no more deep, or there are no more deep pits. So the food doesn't stuck in the pit and fissures, and ultimately there are no caries. Okay, so this is how you can prevent tooth decay. As you can see, prevention of tooth caries, the first is the fluoride application that I told you, the tray we load in your mouth, and then your enamel absorb the fluoride and it remineralizes itself, and hence it is now very resistant to dental caries. The second is the toothpaste. It is shown, it's a home care method, and next is the mouthwash. The girl is doing the mouthwash. Okay, so there are a lot of mouthwashes available in the market. Okay, so basically there are two types of mouthwash. One is for regular use that you can use regularly, and one is for the treatment purpose. That is after we do any gum surgery, or we remove any tooth, or we do the scaling. We recommend that the mouthwash, and that mouthwash is actually chlorhexidine. Okay, so chlorhexidine we cannot prescribe regularly because it causes yellow teeth discoloration and also loss of taste in your tongue. Okay, so these mainly two kind of mouthwash available. One very common mouthwash I will suggest you is the Listerine. Listerine is a very popular brand. Okay, it is used worldwide, and you can use it daily. In the morning, after brushing, just take Listerine. Don't add any water in it, and just gargle or swish for 2 minutes, and then you can spit it out. Okay, don't swallow and spit. Any mouthwash is swallow and spit. It not any mouthwash is swish and spit, not swish and swallow. Okay. So next, as I told you, pit and fissure sealants. Okay, so this is you can see on the left hand side, these are the pits and the fissures, the deep running lines on your tooth. What happens in the second picture, you can see we put a filling. The white, you can see it has blocked the pit and fissures. Okay, so this is actually a preventive measure. It's not a treatment measure. Okay, so this is the way how we prevent the caries. So this is how we apply pit and fissures with the brush on the tooth surface, and then we cure it with the laser. Okay, and then you can see it is all blocked. So the third part is the scaling, the removal of infected plaques. The plaque or calculus is the yellowish hard deposit that you can feel on your tooth. If you put your finger sometimes, and you can feel it that something is very hard on your tooth, and when you break it, it comes in the pieces. Okay, so this is actually the plaque or the calculus that is deposited on our teeth, and by scaling we remove this part. So this is very simple procedure, and you should get the teeth cleaning every 6 months. Okay, even if you maintain your oral hygiene very well, you should go for a professional cleaning, because the plaque and deposit is a daily process. Okay, even when you brush, after brushing, the plaques deposition start. So every 6 months you should visit a dentist to get your scaling done. So what you should know about scaling? Okay, so how often should it be done? As I told before, it should be done every 6 months. Any problems with scaling? No, of course there is no problem with scaling. It's a good part of the treatment, and it helps you in take care of your oral hygiene. Can it damage my teeth? No, scaling doesn't damage your teeth. This is a very common misconception, a very common myth in general public, that if we do the scaling, our teeth become weak. It is not like that. Okay, in fact, your teeth get healthy. So don't be in a misconception that getting the scaling done will lose your teeth, or your teeth will become mobile or something like that. Okay, so what I will tell you what actually happens. When the hard deposit, the plaque or the calculus is on your teeth, you feel that your teeth are strong. In fact, this is degrading your oral health, and especially the gums. Okay, so when we remove the tartar, you feel that your teeth have become loose, or there is space between your teeth. Actually, your teeth are now healthier than before. Okay, so you should get scaling every 6 months. So you can see in the picture, this is the scaling before and after. The before, you can see the black part on the front two teeth. This is the calculus, and after removing, the gums has become very healthy. Now this all were the preventive measures. Now what about the treatment of caries? Okay, so the treatment of caries, the first part, as I told you, is the filling. Okay, so there are two kind of filling. One is the silver amalgam fillings, that you can see the black part, and the other is the composite. The composite is the newer kind of filling that is tooth colored. Okay, so there are various shades, various colors of the tooth filling available. What we do, we first match your the color of your tooth to the filling. Okay, suppose if it is A1 or A2 or B1 or B2, so according to the selected shade, we do the filling, and you don't even feel that there is filling on the tooth, as you can see on the right side. Okay, the next is the root canal treatment, or the RCT. This is my specialization, the endodontics branch. So what happens when the caries go deep into the dentin and into the pulp? Then you start feeling pain. Okay, so now your tooth has to go for a root canal. Now the nerve inside your tooth are infected. Okay, so the second part, if you can see, what we do, we drill the tooth inside, and we reach up to the connective tissue, the pulps where the nerves are there. We remove the nerves with these drills, and then we clean it, and then we fill it again, and then we put a permanent filling on the top of it. So what happens, now your tooth don't have any nerve. Okay, so when you will not have any nerve, you will not feel any pain, because nerves are the part of the body that carries the pain from the tooth to your brain. Okay, so when there is no nerve, you will not feel any pain. Okay, so the next is the extraction. The extraction means removal of the tooth. Okay, so when we cannot save the tooth if the decay is too much, means even if it has gone beyond a repair or beyond any treatment, then ultimately we have to remove the tooth. Okay, so this is the condition where we cannot save the tooth with any treatment, the filling or the root canal. So next is the periodontal disease, or the periodontal disease, also known as the gum disease. Okay, so there are two forms of periodontal disease. One is the gingivitis, and one is the periodontitis. Gingivitis means the inflammation of the gums. Okay, this is a minor condition, and the periodontitis is advanced gingivitis, in which there is a bone loss, and the gums goes down, and your tooth become mobile. Okay, so on the left hand side, you can see the gingiva. It's red, and what are the signs of gingivitis? That you feel pain in the gums, or you feel that when you are brushing, there is a bleeding from the gums, or when you press the gum with your finger, you feel pain or you feel the bleeding. So that is the stage of gingivitis. Now, this gingivitis happen because, as I told you, because of the deposition of the plaque. Okay, so what happens? The plaque deposit on the tooth, and the bacteria in the plaque, they induce inflammation in the gums. So that is why you should go visit your dentist every 6 months to get your teeth clean. When we remove the plaque, the gums again become healthy. So next is the periodontitis, that is advanced gingivitis. Okay, so what happens when you don't get the treatment or you don't remove the plaque? What happens? The plaque runs deep in between the gum and the tooth. As you can see, the pocket written. The gums are going away from the tooth, and ultimately a pocket form. The pocket is a space between the tooth and the gum. What happens? The tooth is normally covered all around by the gum. So when there's a gap between the tooth and the gums, it is known as the pocket. So when the pockets become too much deep, as you can see in the right side, the plaque calculus is going very deep into the bone, and then what happens? The tooth is separated from the gum and it becomes mobile. Means you can feel your tooth is moving. Okay, so this is advanced form of gum disease. That is the periodontitis. Now, what are the symptoms of the periodontal disease? How you know that you have periodontal problem? Okay, the first is, as I told you, is the bleeding gums. When you brush or when you eat something, you have pain in the gums or your gum bleed. The next is the swollen red gums. Means when you place finger on your gums and you press it, you feel pain. The receding gums, or if you feel your gums are going down, the gums pulling out from the teeth, or if you feel that there's a gap between your tooth and the gum. The black or yellow deposit in the teeth, that is known as the tartar or the calculus that I showed you before in the picture. Or you feel that your tooth is loose, means your tooth is moving, or there is sensitivity, or you are taking any hot or cold thing, you feel sensitivity. Or bad breath with pus. What happens when the pocket is infected? There's a pus in the gum, and then there's a foul odor coming out of your mouth in the form of bad breath. So these all are the symptoms of the periodontal disease. So if you have any of these conditions, please visit your dentist and get your treatment. The second thing is, what are the causes? Okay, so of course the first and foremost is poor oral hygiene, not brushing properly. The hormonal changes that happens in pregnancy, especially the gum condition is very very common in pregnancy. In fact, sometimes the gums are so much swollen that we have to cut it with the surgically. We have to remove it surgically. Okay, so this is the thing just happened with me yesterday. I had one patient. The lady, she was pregnant and she has a very huge growth of the gingiva or the gums. And the first thing I asked her, if you are pregnant, and she said yes, I'm pregnant, because that kind of swelling or that kind of growth of the gums can happen only when you some hormonal changes in your body. So what I did, I just removed that part of the growth and advised some mouthwashes, so she will be healthy. Now, certain medications also cause gingival growth. That is, the mostly is the uh, anti-epileptic drugs. Okay, so what we call as epilepsy, okay, migraine, or जिनको मिर्गी आती हैं. So there's a drug known as phenytoin. When we give this drug, it causes gingival enlargement, the enlargement of the gums. Okay, and most of the immunosuppressants like cyclosporin A. Immunosuppressants are the drugs that we give to the patient when we do organ transplantation. Okay? The next is the poor nutrition. If you're not eating healthy, you can have gum disease. The most common problem is the deficiency of vitamin C, that also known as a scurvy. Okay. The ill-fitting dentures means your dentures are not made properly. Smoking, of course, the most common cause of oral conditions. Diabetes, as I told you, the diabetic people is more prone to any infection in the oral cavity. The next is the HIV infections. If you feel any white patch in your mouth, and it is not going away, it is painless, then you should visit your dentist and you should see what it is, because in HIV infections, the oral lesions in form of white or red patches are very very common. Okay, but don't be bothered about anything you see white in your mouth. Okay, so this is the problem with us, that if we know anything, we try to check our mouth. No, it is not nothing. Okay, so it's normally a very big patch. Okay, you can notice it clearly. Okay, so anything red or white in your mouth doesn't mean that you have something related with the conditions of HIV. Okay, now what is the prevention and the treatment of the gum disease? uh, of course, first, to maintain good oral hygiene, and the scaling, as I told you, every 6 months visit your dentist for scaling and root planning and the periodontal surgery. If the gum disease is very advanced, that is the periodontal condition, what we do, we remove the gums and we remove all the infected tissue, and we again replace the gum and we put sutures. Okay, so that is the treatment for advanced conditions of the gums. Now, bad breath, the third most common condition, the oral finding is the bad breath. Okay, so what are the causes of bad breath? The accumulation of plaque and calculus, and the gum disease. Okay, if the gums are infected, you will feel bad breath. The dental caries, the most common factors. Okay, the food was getting dislodged in the caries part, and you feel bad breath. A dry mouth, xerostomia in diabetic patients, or many patients who are on some kind of drugs. So mostly the antihypertensive drugs that we take for blood pressure, many of the drugs, they cause dry mouth condition. The next is the bacteria on the tongue. Okay, so this is the most common condition. You know, we brush everything, we do everything, we do mouthwash, but we don't clean our tongue. Okay, see, the tongue is also a part of our oral cavity. You have to clean your tongue. Okay, so there are a lot of tongue cleaners available in the market. Okay, after brushing, clean your tongue also, because if you don't clean your tongue, normally there's a big coating that develops on the tongue, and this coating is it's kind of give you a bad breath. The next is the abscess teeth, or there's a pus in your teeth, and the oral cancer, and the smoking. Okay, the other causes are the digestion problems. If you have any digestion issues, especially the GERD or the gastrointestinal reflex. Okay, sometimes we when we do something like that, the liquid from our the liquid come in our oral cavity. Okay, so that is the digestion problem. The sinusitis, we have cold in our nose, then we feel bad breath, and of course the cough and cold. So the prevention treatment of bad breath, oral hygiene practices, treatment of underlying problems, any gum conditions or any dental caries, the dental treatment, and the smoking cessation. You have to stop smoking, avoid certain foods. You have to avoid certain spicy and flavored food. Like most common is the garlic and the onion, and then keep the mouth hydrated. Okay, sip water every 30 minutes, or drink water every hour, something like that. Okay, so if you eat anything, the water will clear it, and you will not feel bad breath. The next condition is the tooth sensitivity. So what are the causes? What is the tooth sensitivity actually? So when you take anything hot or cold, you feel too much pain. Okay, the pain subsides after a few seconds. Okay, so that is a tooth sensitivity. So what is the cause? The tooth attrition. When your tooth is eroded, or the tooth is abraded, and there is a cracked tooth, or there is a crack in your tooth that you are not noticing, or the indentation of the tooth, or there is any deep hole on your tooth. For the gum recession, the gums protect the teeth. So if the gums are not covering the tooth, you will feel tooth sensitivity. As you can see in the pictures, okay, on the left side there is indentation of the gum, and on the right side there is a receding gum, that is the gum is not covering the tooth. And now how you prevent the tooth sensitivity? First, correct brushing techniques. So most of the time what we do, we do very aggressive brushing. Okay, and we don't have to brush like that. especially the horizontal brushing like this is very harmful for your teeth. What happens, it will cut your teeth just below the gums, and then you will start feeling sensitivity. Then you have to use consumption of water. You have to drink water after acidic foods. Okay, if you take any orange juice or something like that, okay, or you make nimu sikanji or lemonade, okay, you have to use water after that, because the acid and the food that will cause sensitivity in your teeth. Do not brush immediately after eating. Okay, normally make a practice of brushing after 30 minutes of eating. And you reduce or stop carbonated drinks. Okay, so the Coca-Cola and all these drinks, you should avoid it. Make use of straw. What happens when you use the straw, the liquid doesn't spill on all of your teeth, and then your teeth will be protected. And the use of sugar-free chewing gums. Okay, so chewing gums are actually very helpful in maintaining your oral hygiene. What happens when we chew any gums? Okay, it massage your tongue, massage your gums, and also the most importantly, it increases the saliva secretion. Okay, and as you know, saliva is very beneficial for our oral cavity. It cleans our oral cavity. Okay, so that was the preventive measure. Now, how we treat the tooth sensitivity? The first is the scaling. Okay, so get the cleaning done. The restorations, if you feel there is a decay in your teeth, then get the fillings and the crowns that we known as the caps. Okay, if there's too much sensitivity, then we have to go for a crown. That is, we have to cover the whole part of the tooth. Then the fluoride application, it is very important treatment measure. Okay, so when you have decalcification or your enamel is weak, then you will feel sensitivity. So with the fluoride, we can treat that sensitivity part. The periodontal surgery in case of advanced conditions. Okay, so the next thing is unattractive smile. Okay, the malalignment of the teeth, or the crooked teeth, or if you can see there is spacing between the teeth. So this is very unaesthetic condition. Okay, of course everybody wants to have a good smile, and if you have such kind of teeth, so it's very difficult. I've seen people who are covering their mouth when they are speaking or something like that. They're just hiding their smile. Okay, so this all happens because your teeth are not properly aligned. The next condition is the discolored teeth. Okay, so it can happen because of many reasons. The first is the fluorosis teeth stains. This is a very common condition in Haryana. This white and yellow chalky spots. Okay, the Jhajjar and the Rewari districts are the high fluoride areas. Okay, the water is not good, so you will see a lot of people with such kind of teeth. These are known as chalky spots, the white chalks. The next is the tobacco stains. The people who consume tobacco in any form, like BD, cigarette, or physical form of tobacco, they will have such kind of discoloration. So next is the tetracycline staining. Okay, this happens when during the childhood, if you consumed any drug, tetracycline, it is deposited inside your teeth and it causes this discoloration. The next is the tooth trauma. Any trauma to the tooth can lead to the discoloration of the tooth. If you can see the one tooth is black. Okay, so this is very common observation you can see in many people. Normally the front tooth, one of the tooth is black. Okay, so this happens when you get any trauma to the tooth and the blood supply to the tooth is cut off because of the trauma, and the tooth become black. So next is the unattractive smile. Okay, so this is the gummy smile. As you can see, the whole part of the gums are visible. Of course, this is not a good smile, so we can correct with cosmetic surgeries. And the next is fracture of the missing tooth. Also, it is very common. The front teeth are missing or the back teeth are missing. So, what are the prevention of unattractive smile? Interceptive or preventing orthodontics. This is the part of the braces. So we put the braces and we correct it. Then we have habit breaking devices. Some of the children, like it's on the figure, they have habit of sucking the thumb or any finger. Okay, because of that, their teeth become forward and dispose malaligned teeth. So what we do, we put habit breaking up devices inside the mouth. Okay, so these are palatal clips. If the child put the finger inside, he will feel pain in the finger, so he will stop putting it. Some people have habit of chewing lips with the teeth. Okay, and mouth breathing. Some people, they breathe from the mouth, so they will there's malalignment of the teeth because of that. Tongue thrusting. Some people have habit of putting their tongue between the teeth continuously. So what happens, eventually the teeth move and there's a gap between the teeth. Avoid certain medication in childhood, as I told, the tetracycline, and avoid smoking. So what is the treatment of unattractive smile? Okay, so the orthodontics or the braces, we put the, nowadays there are two colored braces available, so you don't have to go for the metal brackets. And what happens now, normally we put the braces in front of the teeth. Now we can put behind the teeth and we can hide your braces. Okay, so nobody will notice that you have braces. And this is an Invisalign is a modern concept, as you can see in the first picture. There is a tray that we make, and you have to wear this tray, and ultimately your teeth will correct its position. So this is the treatment of unattractive smile. The bleaching, this bleaching we use 35% hydrogen peroxide. Okay, so we bleach your teeth. What happens? The bleach, the acid, it removes the yellow color of your teeth, and it becomes white. It is not a. I will not advise this treatment. No, I'm against the bleaching of the teeth, because with the acid, the teeth become very weak. So next is the veneers. This is small coating of the zirconia that we place on the tooth. Okay, so in this we just place the coating just in the front part, the part of the teeth that is visible. Okay, so that way we can correct the unattractive smile. The next is the crowns, and the implant. For any missing tooth, we can place the implant. So also we can correct your smile with composite fillings, periodontal surgeries, and teeth replacement. That's bridge and dental implants. Okay, so the next condition is the abscess ulcers. Okay, so you must have heard many people continuously or frequently having ulcer in their mouth. Okay, so these are the idiopathic causes. Okay, we don't know what is the cause. Sometimes it is immune cause, or sometimes it is because of deficiency of a particular vitamin. Okay, so what are the palliative treatment for this? We give vitamin supplements, especially zinc and folic acid. And then we put anesthetic or antiseptic mouthwashes we prescribe to the patient, and some kind of ointment, so they have to apply it on the ulcer. And also sometimes we prescribe antacids and antihistaminics. Antihistaminics normally they suppress the inflammation in the ulcer. Okay, the next is the oral cancer. Okay, so this account for 1/3 of the oral cancer is very common even in India, especially in south of India, where there's a habit of pipe smoking. So these are all the bad part of the cigarette. Okay, you can see all the chemicals which are very harmful for your body. Now, what are the causes of oral cancer? There's tobacco in any form, that heavy consumption of alcohol, or any prolonged exposure to radiations, or any prolonged irritation with sharp objects like ill-fitting dentures. How you know that you have oral cancer? Okay, so if there's a white or red patch of skin or mouth under the tongue, or you have a lump, or you feel any lump in your mouth or in the throat, or this is very most common, the third part. If you feel there is any ulcer in your mouth that is bleeding and that is not healing for more than 2 weeks, you are getting every treatment, you are taking your antibiotics, or you are applying the ointments, but the ulcer is not going away, it means you have to then you have to check the ulcer for any malignancy. Now, difficulty in swallowing for a prolonged period. If you feel that you are not swallowing properly, or not able to swallow, or you have pain in swallowing, then you should check with the better with the ENT doctor. Now, this is the prevention and treatment of, this is actually after smoking. As you can see, there's lot of good effect if you stop smoking. After 20 minutes, your blood pressure is normal. After 8 hours, the carbon monoxide level is good in you. After 20 hours of stopping smoking, there are very chances of heart attack. And as you can see, in the last 10 years, the risk of dying from lung cancer is about half of the current smoker. It means after 10 years, if a person is smoking, has more chances of getting lung cancer than a person who is not smoking. So quit smoking. Smoking is very dangerous, guys. I'm telling you, you feel very good when you smoke, but when you will find anything, I have seen patients, literally crying, especially tobacco and gutka chewing. So when we tell them what happens normally, they are not able to open their mouth, and they say, I am not able to my mouth, and they are tobacco chewers. This is the precondition. This is a condition before cancer. Okay, the tissues inside the mouth, they becomes thick, so the patient cannot open, and that is known as the precancerous condition. Okay, so any form of tobacco, you have to stop right now. So what is the prevention treatment? Get check scaling every 6 months. Report to the doctor if you feel any symptoms, and if you have any ulcer, get a biopsy. And the next is a surgical treatment. We remove the malignant part of the oral cavity. Okay. So what are the oral hygiene habits? Brushing twice daily. Okay, and the most important point is the correct brushing method. Okay, even if you do one time brushing, you use correct method, it is as equal as brushing twice. Okay, so choose the right brush that is soft or ultra soft. If you have gum conditions, there are a lot of toothbrush and toothpaste available for small kids, and now there are newly available brushes that is electric or battery operated. If you feel that you cannot brush your teeth properly, you're too lazy, then you can buy an electric toothbrush. So this is how you brush. You have to keep your tongue, education in the first picture, at 45-degree angle, and then you have to swipe up and down. Okay, then in the second condition, inside of the teeth, third also inside of the teeth, and then on the top, the next is the top part and the front part. So see, this is the main part of brushing techniques. You don't have to brush back and forth. Okay, you have to brush, either you make round motion on the back side, and the front you have to make up and down. Okay, so this is the correct method of brushing. So this is when to change your brush. You should change your brush every 3 months, because the bristles, they get distorted, and now they can no more clean your teeth. Okay, so you have to change your brush every 3 months. Next is the flossing. This is a kind of thread. Okay, so it removes the plaque from the areas where your brush cannot reach, especially between the teeth. Your brush cannot reach. So this is the thread or the dental floss. This is best done before the brushing. Okay, so how to do it? I will tell you. Just hold the floss between your thumbs or the finger, and then you put inside your teeth. Okay, and then you just do the vertical motion, in and out motion. Okay, and make sure that you don't traumatize your gums, or you don't harm your gums. Okay, so you have to place the thread between the tooth and the gum, and then you have to clean it. So the mouthwash is best done 1 hour after brushing, as I told you, and there are a lot of mouthwashes available: chlorhexidine and fluoridated mouthwash, and anti-sensitivity. And then you can have sugar-free chewing gums. You can take 15 minutes after meals. As I told you, they stimulate salivary secretion and remove food and debris from your mouth. And also they die the urge of having a cigarette. Now the toothpaste, there are a lot of toothpaste available: fluoridated toothpaste, non-fluoridated, and the anti-sensitivity toothpaste. Now the diet is also a very important aspect to maintain a good oral health. You should avoid eating sweet and sticky food. Eat food rich in fibers, and take fruit and vegetables. These are the natural cleaners. And drink plenty of water. Sip some water after eating. That will help dilute the acid. Any acidic beverages or Coca-Cola or anything you take, just sip some water, and it will clean your mouth. Then rinse your mouth after every meal. This is very important. If you don't have time to brush, just rinse your mouth with plain water after having food. Okay, thank you. And now I will discuss some of common myths and what are the facts. Okay, so about the dental caries, the most common myth is that it is caused by a worm or what we say kida. We have seen a lot of people, they're saying मेरे दांत में कीड़ा लगा है कीड़े के कारण. And we have seen some people, they are treating you for dental caries, they will come and they will remove the worm or the kida and they will show you. Okay, so this is a myth. There's no such thing as the dental caries is not caused by any worm और कोई कीड़े से नहीं होता है. It is caused by the acid. The acid is produced by the bacteria, and the acid is produced by the bacteria from the sugar that you take. Okay. The next common, this is about the dental caries, and the next common myth is about the gum care that I told you. Yeah. One more thing is that I have seen most of patients saying that, especially in India, they're saying that our eyesight will become weak if we'll remove any tooth or we'll do any treatment to the tooth. Okay, this is absolutely a myth. There is no relation between the tooth and the eye. Okay, the nerves that supply the eye and the nerves that supply the teeth are completely different. Okay, so don't be scared or don't have this misconception that you will lose your eyes or you'll lose your eyesight if you have the tooth pulled out. Okay, there is nothing like that. The next common thing is the scaling part that I told you. Most of the people, they say that their teeth will become weak if they will get the scaling done. It's nothing like that. Scaling is very beneficial for your gum conditions. Okay, so do the scaling every 6 months. So next is this is a particular topic about the women, the ladies, the girls who have joined. Okay, the oral hygiene and the pregnancy. Okay, so it is a very popular trend in Haryana that when a girl is pregnant or when he has delivered a baby, she is asked by the elderly women that don't brush your teeth. If you'll brush your teeth, the teeth will become weak and you will lose your teeth. Okay, this is a very big misconception. Okay, जैसे कि जापे में ब्रश करोगी तो तुम्हारे ब्रश खराब हो जाएंगे. ओके, जापे में ब्रश करने से कभी भी किसी के दांत खराब नहीं होते हैं. जापे में ब्रश नहीं करने से आपकी प्रॉब्लम ज्यादा बढ़ जाती है. ओके, सो most of the women that face dental problems or gum problems of during the delivery, after the delivery or before the delivery, is because they are not brushing. Okay, so as I told you before, in pregnancy there are a lot of hormone variation in a women body. Okay, and these hormone variations cause a lot of gum conditions especially. So if already there is an issue in your mouth, you are pregnant and you are very prone to gum infection, and after that you are not brushing also, this is very harmful. This is very detritus for your oral health. Okay, so I advise every girl, every woman who has joined here, don't listen to these things that due to. In fact, I will advise you to take even better care of your oral health during pregnancy. Okay, when you are pregnant, brush 2 times, do mouth washes, and even after the delivery, during the period when you are on the rest, जिसको हम जापा बोलते हैं, जापे में भी आपको 2 टाइम पे ब्रश करना है. ओके, ब्रश करना है और माउथ वॉश करना है. उससे क्या होगा कि आपकी जो जब तक आपके हार्मोन्स आपकी बॉडी में बैलेंस नहीं हो जाएंगे, until then you will be in a better condition. Okay, so this is one of the misconceptions that I wanted to talk about. Even in my relations, many of the ladies, they call me and they said, we don't have to brush after the delivery. Okay, so take care of this thing. Okay, and okay guys, these are the misconceptions and the myths and the facts I told you. Now if you have any question, please let me know. I will answer these questions. Okay.
Thank you very much, Dr. Karminder, for such a nice expert talk. I think this is the best lecture I have heard anything about the myths and facts of the oral hygiene. So I request all the participants, if they have any question, then Dr. Karminder will explain all those queries in a very mature way. So I request all the participants, please ask your questions. Is there any question? Naveen if there is any question, you can unmute that particular participant. He or she can ask.
Okay, sir.
If there is any question, you just can raise your hand. I think 3 hands are still raised. So I think they have any question. Divya Yadav, Himani, might be they have any question.
Okay, I can answer their queries, but where I find their questions, or they'll just me.
Rahul is also raising his hand. So Rahul, you can unmute yourself and ask the question. Rahul, you can unmute yourself.
Yes, Rahul, let me know
Yes.
anything you want to ask.
Yes, go. Sir.
Yeah, tell me, I can hear you.
Himani, I think Himani is there. Might be she has any question. Himani.
मैम आ जाओ पहला मैं डाउनलोड करूँ गूगल मीट
Yes, good sir.
Good morning,
Yeah,
respected sir. Myself, Yash
good.
God. I'm assistant professor at RPS Degree College. Can you hear me?
Yes, hi, yes, how are you?
Okay, thank you, sir. First of all, I would like to thank you very much because this was the best expert lecture that I have been attended in my life here. It was very informative in everyday life. Thank you, sir. Sir, my question is this: does the condition of gingivitis can lead to the breakage of teeth?
Condition of sorry, gingivitis?
The condition of gingivitis can lead to the breakage of tooth or teeth.
You are talking about gingivitis, right?
Yes, sir.
Okay, no, there's nothing like gingivitis is the early condition of gum disease. Okay,
Yes.
so in that, if you get scaling every 6 months and you brush properly, it will not lead to the periodontal condition. That is the more advanced stage of gingivitis. So it will not break your teeth. Okay, it is just now limited to the gums. It has not gone into the bone. Okay, so
Yes.
if it is just gingivitis, there's no don't worry. Just brush nicely and get. I will advise you get your scaling done. Okay, the cleaning of your teeth.
Okay, thank you, sir. Thank you so much.
Yeah. Okay.
Neha 577.
Hello, sir.
Hi,
Yes.
Udam.